Hello everyone, my name is Bongjou Chen. Today I am presenting my research on prolonged standing in the operating room, which is constructed under the mentorship of Hamada Sadi, Dr. Dimitrios Stefanidis, and Dr. Danny Yu. Starting with background, prolonged standing is strongly associated with fatigue and affects many occupations, such as surgeons. Surgeons are required to stand beside patient beds in static positions for long hours. In addition, they cannot take long breaks and their activities are restricted in the operating rooms. Because of prolonged standing, surgeons are put into higher ergonomic risk for musculoskeletal injuries and have suffered from severe health problems such as high blood pressure and varicose veins, which negatively impact their performance. And they have also consistently reported fatigue. As a result, patient outcomes and surgeons' career longevity have been threatened, and these are the reasons why we look into surgeons. Previous research studies have shown that a lack of dynamic movement for even just 30 minutes can lead to discomfort, while the average surgery time is about 3 hours. Some current interventions to mitigate the adverse health impact include intermittent sitting, changing shoes or floor conditions, and adjusting postures. While these interventions are suggested, they are not appropriate for operating rooms environment. With this in mind, our study is aimed to investigate how surgeons use weight shifts and other small foot movements to mitigate the effects of prolonged standing during surgeries. Because attending surgeons and their assistants serve different functions and perform different activities during surgeries, we focus our study on answering the following two questions. What are the critical metrics related to surgeons' standing patterns? And how do their job-specific roles impact their standing patterns? Our research design is interdisciplinary. This is a biometric-focused ergonomic project, and it is concerned with industrial engineering, medical and clinical science, as well as cognitive psychology. Our methodology includes using statistical approaches to evaluate metrics as well as collect discomfort surveys from surgeons to assess their fatigue levels based on their physical, mental, and cognitive workload, in order to provide a holistic view of the effect of prolonged standing on surgeons. It is important for us to not only collect objective data, their standing patterns from MATLAB images, but also to collect subjective data from pre- and post-discomfort surveys. We also need to analyze their workplace environment, their interaction with equipment in the operating rooms, and their physical and mental states to determine how surgeons are affected by prolonged standing. Our research team consists of both engineers and clinical investigators so that we are able to use different expertise when we conduct our interdisciplinary research, whether it's the study design, data collection, data processing procedures, or conclusions. Incorporating diverse disciplines into our research help us to study our research questions in a variety of perspectives and dimensions. And it also helps us to deliver results, state conclusions, and make impact that would benefit multiple fields of research. My research looks into surgeons who perform laparoscopic surgeries, and their activities and fatigue levels on the feet were recorded by a pressure mat and pre- and post-discomfort surveys. We studied 9 attending and 7 assisting surgeons in a total of 16 surgeries, and we processed and analyzed the data using the outputs from MATLAB algorithm. The metrics we measured and keep track of include center of pressure, body weight shift, entropy, and other postural changes. First, let me introduce the center of pressure. This is the point where the total sum of a pressure field acts on a body, causing a force to act through that point. It is used to measure the postural sway of the human body. We have the centers of pressure for the attending surgeon and assisting surgeon circled in figure 2. Second, we have F sub R representing the body weight on the right foot for both surgeons. And third, we have F sub L representing the body weight on the left foot for both surgeons. Next, let me introduce the body weight shifts. The circles and asterisks on the top of Figure 3 indicates the shifts the surgeon had. And the tracing lines in normalized right force versus time chart indicates how their body weight changes over time. Using the formula on the right for calculating the normalized right force, we can know if their body weights are more on the right foot or more towards on the left foot. When it equals to 0.5, it tells us that all body weight was on the right, while negative 0.5 would tell us that all body weight was on the left. If normalized right force equals to 0, then it indicates the surgeon is off the mat. Let's look at a sample result for an assisting surgeon. With the data from the normalized right force, we can derive where the body weight shift occurred. In a time frame of 150 minutes, the surgeon shifted more frequently for the last 10% of the time than the first 10%, with an increase of 3.9 shifts per minute. Based on the changing body weight shift over time, we summarized with the average shift per minute for surgeons in each exposure. Depending on their overall fatigue levels, we grouped them into fatigued and non-fatigued groups. Looking at Figure 5, we have 7 surgeons who are fatigued and 9 surgeons who are not fatigued. We also know that average shift per minute increased over time for fatigued surgeons, while it slightly decreased for non-fatigued surgeons. Let's look at the percent over the mat for surgeons. We calculated the percentage for each surgeon by using the number of frames with feet present on the mat divided by the number of frames without feet present on the mat. Note that we consider the feet to be present if at least 50% of the feet appear in the frames. We found out assisting surgeons are more static on the mat than attending surgeons. On average, the assisting surgeons stood on the mat 12.5% more of the time than attending surgeons, and the assisting surgeons shifted 2.5 times less per minute than attending surgeons did. Next, let me introduce entropy in our context. Entropy is the irregularity of the center of pressure. It assesses the regularity or predictability of the center of pressure over time. In our study, we quantify surgeons' body sway by measuring their entropy in medial lateral and anterior posterior axes, and these are shown in Figure 7 and 8. Using the equation for sample entropy on the top, we are able to trace the changes in center of pressure in medial lateral and anterior posterior directions over time. The traces of center of pressure in these two directions have a random shape shown in Figure 9, and the changes in center of pressure over time in each direction are shown in Figure 10. Looking at the results on entropy for fatigued and non-fatigued surgeons, we concluded that the entropy for both of them decreased over time with similar trends, which means that they both had less body sway over time. As a result, we are able to identify and measure 3 standing-related metrics, including center of pressure, body weight shift, and entropy. In general, we found out assisting surgeons are more static on the mat than attending surgeons, and the assisting surgeons shifted less than attending surgeons did. With our results on center of pressure and entropy, we also know that both attending and assisting surgeons had less body sway over time. As we do further analysis, we look forward to assessing other postural changes to characterize the standing patterns between attending and assisting surgeons, because they serve different functions and perform different activities during surgeries. Second, we summarize the table based on the overall fatigue levels for all the surgeons. From our table, we can also conclude that there are less assisting surgeons who are fatigued in our study sample. Third, we will also work on implying job-specific interventions to reduce surgeons' fatigue and discomfort. We also look forward to collecting more data to increase our sample size in the future. Through our research study, we make meaningful contributions that provide implications on practical interventions in designing operating rooms. These insights will help improve surgical performance and patient outcomes. We can make surgeons to achieve longer career lives and life expectancy. Thank you.